Hello and welcome to Max Health, your one-stop shop to everything health. Today we're going to be talking about understanding food medicine interactions. Yes, understanding food medicine interaction. Amazing, right? Yeah, I'm so excited. Anyways, just imagine like you're trying to do everything right with your health, eating nutritious foods, taking your prescribed medication. But what if I told you that some of these good choices might actually be working against each other? Yeah, they might be working against each other. So, we're going to talk about some food drug interactions. I know I mentioned it sometimes in some of my videos, but this one is just focusing on food medicine interactions with just a few, maybe like five or six that we're going to talk about. But yeah, just a few. So if you're like when you take food or drinks, and sometimes they like change the way the medications that you use actually work. And you'll be surprised. You have like surprising consequences. So I'll tell you how some of these things can actually have affect your well-being or affect how the medicines perform. Sometimes when you take some antibiotics, some antidepressants, or even some regular over-the-counter vitamins, like you just need to know these potential interactions and it will actually make a big difference in your health journey. So stay tuned, don't go anywhere. I'm going to get right into it and I'll tell you real life examples how maybe like grapefruit juice can interfere with some of your blood pressure medications, how you can avoid like taking some dairy with some certain antibiotics, some certain green leafy vegetables that can actually impact some of your blood thinners. Just sharing you a few essential tips that can help you navigate these interactions and just safe how you can make safe and effective choices when you're taking your medications with your food. Yeah. Anyways, let's get started. So food medicine interaction usually occurs when maybe you take your food and then you take it or maybe you drink it's your medicine. Yeah. And then it will alter the food inside your body as a human being when you take them. And there will be some alteration somewhere along the line in your human body. And then you won't feel good anymore. Something of that sort. And this can actually happen when both the prescription and the over-the-counter medicine, maybe your antacids, your vitamins, maybe your iron pills, herbs, supplements, and maybe various prescribed medicines. So some certain medicines that we can talk about that can be affected, your antacids, vitamins, your iron pills, herbs, your supplements, some of your supplements, and some of your prescribed medications. So some oral medications for diabetes, some for antidepressants, and even some cholesterol medicines. And how can this actually affect the medicine? So some certain nutrients can alter um they can alter absorption, they can alter metabolism, that's like breakdown of food inside your body. They can alter elimination, excretion, and letting out of any of these food nutrients out of your system, or just generally change their effectiveness. And once they alter all this will just lead to changing the effectiveness of the medicine. to changing the effectiveness. And okay, we start from maybe like acidity of fruit juice. So some very common interactions, like the ones we talk about. Um, Let me see. Acidity of fruit juice. So, like the acidity of fruit juice, something like orange juice, because orange juice is really acidic. It can reduce how well your antibiotics, like penicillin, can work. So, it's just reduce it. So, like when you take increased intake of your orange juice, which is high in acid, to just reduce how the effectiveness of your penicillin can work. So the acidic environment will just break down the antibiotic before it has even a chance to be absorbed effectively in your body. And something else you can also, like dairy foods and drinks. I'm sure you might have heard this a number of times, but please, when you're taking your medication, just be aware of what you're eating and drinking and how it can affect what you're taking with your meds. You just ask yourself, why is my medication not working? But it's just simple things like this that you're not doing. So, for example, dairy foods like your milk or maybe cheese. Yes, and cheese. So, just once you're taking it, like an increased intake of this, so actually just leads to affect your tetracycline antibiotics, even some of your fluoroquinolones like ciprofloxacin, which also helps to fight infection. So what happens is the calcium here would actually bind to the tetracycline, and then it will lead to an insoluble complex that is not easily absorbed in the body. So there'll be binding to this. And then we talk about green leafy vegetables. Yes, your green leafy vegetables. And we all love vegetables. Don't we just love our veggies? I love eating my vegetables, don't you? And vegetables are really good for our bodies. Helps with our immunity, helps with blood level, helps with our gut system. Just really, really great for the whole well-being of any human being. Eat your leafy greens daily. It's an all-rounder. But then again, when you might be eating, what if you're not eating it right? For example, your spinach and maybe your kale. I love this too, especially when you mix them up together. Nice. And they're usually high in vitamin K, which is a good thing for your blood. Okay, sorry for you. They're high in vitamin K, and they affect medications like warfarin. Yes, they will stop the effects of warfarin. And warfarin is a blood thinner. It's a blood thinning agent, which is a blood thinner. So what vitamin K does? Vitamin K actually promotes clotting. And then blood thinner, this is an anticoagulant. So for those who actually have their blood that is so coagulated together, they have maybe probably high vitamin K levels, or for whatever reason that they have their blood being coagulated, and they're supposed to take warfarin, and then you're eating so much leafy greens, and then you're using warfarin together, you're just canceling out the effects. You're just not making it work like it's supposed to. And then to counter the anticoagulant effect of warfarin. So you have to be careful. What you should Then another one is monoamine oxidase inhibitors. Monoamine oxidase inhibitors and tyramine. So monoamine oxidase inhibitors, they're usually used to treat depression. And they're not usually safe when they are mixed with foods or drinks that contain tyramine. So these foods that contain tyramine include like your beer, red wine, which is something people take a lot of the time. Like you're taking red wine. Do you know if it's good with that medication you just took about 5 minutes ago? Chocolate, all you sweet tooth lovers. Processed meats, avocados. These are foods that contain tyramine. And they're not just good with your monoamine oxidase inhibitors. And some certain cheese actually, they're not good for it. So you have to be careful. You have to really, really be careful so that you do not take them together. And I'm sure you're wondering, you're asking, what are these drugs that are monoamine oxidase inhibitors? So for example, like your selegiline, your isocarboxacid. So if you know anyone that is on any of these antidepressants, that is probably treating depression, you should tell them they need to avoid taking it together with all these red meats, things that can produce tyramine, red wine, processed meat, chocolate, avocados, and the likes. So next we'll talk about grapefruit juice. Very, very important. It can't be oversaid. And we'll keep talking about it till it sticks. Even if it sticks, we'll keep talking about it till everyone knows and everyone prevents themselves from using their grapefruit juice with some of their blood pressure medications. And the truth is, we have quite a number of people who are hypertensive. So hypertension is a global heart illness that affects like will I say a vast majority of people from young to old to aged, like plus some blood pressure medications. Also, some organ. One thing, grapefruit juice actually affects a lot of medications, not just blood pressure medications, even some anti-malarials, antiparasitics, and some organ transplant medicines. Some cholesterol lowering drugs. What happens is that once you take this grapefruit juice, like in high quantity, so an increase in your grapefruit juice will just actually break down. Is it that it increases or it decreases the breakdown of these medicines in your body, and it can actually be potentially harmful levels, which can lead to potentially harmful levels or even reduced effectiveness. So if there's an increase in the grapefruit juice, is either it causes a decrease or an increase. depending on the particular medication. So half of the time you're going to have to speak with your healthcare provider, your pharmacist, who is going to tell you, oh, for this particular medication you're taking, the grapefruit juice is going to increase or decrease it. It's going to be, and this effect is either going to be harmful or just not even allow this medication to work in your system. And then we have meal timing consumption, meal timing and composition. So actually, some medicines are only absorbed if they are taken with a full meal or sometimes with maybe high fatty meals. So whether they're taking with a full meal or maybe just high fatty meal. Yes, high fatty meal or fat meal. Or some of them even just on an empty stomach. So you're supposed to know that this particular medication, I'm supposed to take it with food or with high fatty food or before food or after food or even just on an empty stomach. For example, your pain relievers or NSAIDs, non-steroid anti-inflammatory drugs. So your NSAIDs, you have to take them with food. That's after food or immediately after you're eating or while you're eating because they need to be taken with food. Some antibiotics need to be taken before food or even on an empty stomach. And your pain relievers are actually better absorbed with food so that they can reduce any form of stomach irritation. While some other medications, like some of your antibiotics, need to be taken on an empty stomach so that they can have optimal absorption. So I'll just quickly give you some general safety tips, or rather, some general advice to take your medicine safely. Safely take your medicines. So first and foremost, always consult your healthcare providers. It's like your healthcare provider has the best information for you concerning your medications and the interaction with what you eat and how you eat. And when I mean healthcare provider, I'm particularly talking about your pharmacists. Yes, we, the pharmacists, actually know these things, and that is what we help you with. We have the knowledge of these things. We have all the resources and references we can check for you. Even it's over time with experience that we actually know these things off the top of our heads. But initially, for the young ones in practice, they would have to still check reference books and help you make sure that this particular medicine you're taking goes well with your body, goes well with the food, whether you're taking before food, after food, or whatever food you might want to combine with your medicine, whether you should take it an hour before or take it 4 hours before, or not even take it at all during the duration of taking your medicine. Another thing that can actually help you is always reading labels. I know some of you always like, oh, you don't want to read the labels, but the labels are there to always help you. We always don't know everything, and sometimes you might skip some information. No human being is perfect. Okay, I'm sure you know no human being is perfect, and you are in a better position to actually help protect yourself. So most of the time, we always add these labels to your medication for your own use. Labels are not there for decoration. You're supposed to read it. So you carefully read the labels on the container. If you actually don't understand anything, just ask your healthcare provider or your pharmacist. You follow the directions, you follow the warnings, you follow all the interaction precautions that are printed on your medicine labels, including the over-the-counter medications. Just read it. It's there for a reason and it's there for you. Another advice, use water. Water cannot be overstated. Universal solvents. Oh, we love this. We just love this. Take your medicines with a full glass of water. Unless you're otherwise told by your doctor or your pharmacist, water actually helps your medicines to dissolve and so that it can be absorbed more effectively. in your body. Another thing we need to know is avoid mixing medicines with food or hot drinks. Like, don't mix it with your food. Don't cook your medicine and your food together. You'll be surprised. Like, avoid mixing your medicines with food or hot drinks. You'd be surprised. So don't stir your medicine into your food, or you take capsules apart. Like, don't take capsules apart. I see some people actually do that, take capsules apart and then pour the contents of the capsules inside the water or inside a liquid or drink and you take it. No, the capsule is there for a reason. The capsule is there for a reason, to protect the fact that it's not supposed to be released in your mouth. It's going to be released in a particular part in your body, and then you then mix it with a drink. Why do you do this? Unless you're told otherwise by your pharmacist or a healthcare provider, this can actually change how the medication would work. So, similarly, avoid mixing medicines inside hot drinks, as the heat can actually lessen its effectiveness. Another thing you should avoid, please avoid alcohol. Oh my goodness. Please, just anything that is alcoholic, just stay away from it and your medicine. Whatever medication is, they don't go together. No, they do not. So don't take your medication with any form of alcoholic drink. Alcohol can actually alter your medicine absorption and increase or decrease the effectiveness of many medicines. Then communication and consistency. Yes, communication and consistency. Yes, just talk to your healthcare provider, your pharmacist, your doctor, your physician. Talk to them about all the medications that you are taking, including your prescription and over the counter medicines, any form of supplement, any herbs, any vitamins. Just get all your medicines from the same pharmacy. That's always really important. Stop changing your pharmacy here and there, because they might actually, most of the time when you use the same health professional, they always have your information on ground. They know what some to, even if you forget or you've forgotten that you were using a particular thing, they tend to remind you, oh, you took this, you are also on this, so don't use this, don't use that. They usually have your information so that they can ensure consistency and do easy tracking of any potential interaction. And please keep original containers. Stop putting your medicines in other places. Like, please just keep original container. Or even if you put it somewhere else, like label it properly. Because I know sometimes some people might be traveling, they can't take the whole stack, so they just want to take the medications they're using for a couple of days and then just put it well. You can take the labels with you. So just keep all your medicines in the original container for so that you can easily identify them. And then you follow the correct usage or instructions. It's just easier. It's so much easier. It's really easy. So like imagine if maybe you're prescribed like an antibiotic, like maybe for example tetracycline for an infection, and you want to enjoy having a glass of milk with your breakfast. The truth is the calcium is going to bind with the tetracycline to form and um to form an insoluble complex, just like I said earlier. And it's form an insoluble complex that your body cannot absorb. And as a result, the antibiotic may not work effectively. And the infection that you're fighting will not clear up as it's expected. So you have to be aware of all these things. You need to be aware. By being aware, you can actually choose to take your medication either before or after you consume these dairy products, or give a few hours apart so that you can actually ensure like there's better absorption and effectiveness. Just need to understand these food and medicine interactions is really, 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 really important in helping you to maximize how you effectively use your medications and just to help you ensure just to help you ensure safety. What you eat, what you drink can have a huge impact on your medicines. And you can just actually make informed choices and discuss any concerns you have with your healthcare provider. So if you have any further questions, any clarifications, just feel free, ask your healthcare provider or your pharmacist. Stay informed and stay take control of your health. In this journey into like food medicine interactions, just remember this knowledge is your best ally in maintaining your health. Just understand how your food and drinks influence the effectiveness of your medications. Make informed choices that will help you enhance your well being and ensure that your treatment works as intended. Just imagine having the peace of mind that comes from knowing that, oh, you're not only taking the right medication, but you're also supporting your medication with the right diet, with the right drink, like from avoiding any form of grapefruit juice with some of your medications to just being mindful of the dairy that you're taking, milk or cheese. Just make some small adjustments. Like making these little adjustments can just make a huge difference in your health outcomes. Like I hope this video has brought you so much valuable insights and practical tips on how you can navigate some of your food and medicine interactions confidently. Always, always, always consult your healthcare provider or your pharmacist for personalized advice. And continue to educate yourself on how to optimize your diet and your medication regimen. Thank you so much for joining us on this enlightening exploration. Don't forget to like, comment, and subscribe. Just let me know what medication are you using currently. What interactions are you concerned about? Like, are you concerned about the interactions that could happen? Put it in the comment section. We can help you. But first, your healthcare provider is still your first point of contact. Even though I'm a pharmacist, but it will be better for you to meet your healthcare provider who has more of your information and your history. So stay healthy, stay informed, and keep making choices that support your best health. Talk to you soon. Bye for now.